about data-driven well-being. So again, my first question, Danny, if you could kind of talk about how you'd utilize data whilst kind of maintaining trust within the workforce.
Absolutely. So transparency is key with this. So for me, I think it's very important that organizations are sending out regular surveys, are doing listening circles, are doing focus groups, are really listening and getting information and insight from their people around this space. Yeah. And when they are looking to get this information, what they need to do is be really transparent and say, these are the results of what we've got. I've worked in a lot of organizations before where we do all this research and surveys and then no one ever sees the data. And nothing's ever done with it. Yeah. It's really important that it's transparent. The other thing as well is you should give people the opportunity to be able to opt in and opt out if they want to communicate how they're feeling and what's going on in their world from a mental health and well-being point of view. It shouldn't be mandatory and forced. I've seen that. So you have certain situations where companies are like, right, we need this data, it's really important. And then they try and mandate people doing it.
Yeah.
You get more engagement and more people doing it if you actually make people feel that this is really important and we're going to do something with it. So the more you do something with the data and actually have tangible initiatives and actions that come out of the data, people will be reminding you about the survey. Because trust me, I've been there too. Like people are, all right, what's the survey coming out? I've got some stuff I want to share, some exciting stuff, I think that we can do in this space. So, and I think the other thing as well is that when it comes to the data, I think this might go on to another question, but when it comes to the data, there's certain things the data can show and what it can't show. So the data can show for me, it can show insight, it can show level of engagement, it can show, if you segment the data into different groups, you can see which groups and which communities are maybe suffering more with mental well-being versus another, versus regions and countries and stuff like that. The thing the data doesn't show is the behaviors and the reasons why mental well-being and the issues are the way they are. And that is why it's very important to not just send out surveys, but also speak to your people and find out what's going on and find out what the themes are. And that's where I think, surveys, as well as like listening circles and focus groups and really speaking to people is really key for me.
Yeah, brilliant. And obviously, Nicola, I'm sure you can expand on that as well, just in terms of evaluating well-being outside of a data-driven culture.
Yeah. I mean, data is how we are able to understand everything now. And to make health and well-being interventions effective, we need an evidence base.
Yeah.
And quantitative data, which is what we're mainly talking about here, numbers, figures, surveys, can give us some story to work with, but we definitely need qualitative data as well. So many organizations forget about that. It is not that expensive, it's cost effective. Bring someone in to do some short-term focus groups, some some interviews, some ethnography, some case studies, get that little bit of work done. And you know what, your impact report showing what you do is going to have that in there too. Evidence showing what your colleagues are saying and how they're feeling, if it's positive, is your best marketing tool. So why you don't want to miss out on this opportunity. Don't be afraid of data. Data is a fantastic thing. We don't know what's happening unless we use data, quantitative or qualitative, and data can help us. I mean, it's so clever now. I mean, we can use data to nudge us in our calendars when we've got too many meetings, to take a break. We can use data to help us schedule things. In terms of the negative impact of data, we do know, from studies, the American Psychological Association showed that the ton of productivity software, the time tracking software, can create high stress and low resilience in colleagues. So that's something that needs to be thought about, because I know it's on quite a lot of software in a lot of organizations, but it can actually decrease skill attainment, and it can, so the research says anyway. So I think that organizations have to be careful when they look at what they're using data for. Are you tracking productivity? Are you asking something? Are you looking at scheduling? Are you interacting? What's happening? So, data-driven well-being is a massive minefield, and it can be used really productively, but there's also loopholes there.